You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, she says that nobody should be wearing a loose-fitting denture. With us, we have Dr. Monica Armendariz. Dr. Armendariz, welcome to the program.
Thank you, Randy. Thank you for having me.
Good. Now, for people that don't know your practice, like who's the typical implant patient that's coming in these days?
So typically there are two different kinds of patients. The first patient is somebody who's been wearing this denture for years. They have been through ill-fitting denture, the bone is shrinking, they've done reline after reline, and they're sick of it. They say, I'm done with the glue, I'm over it, I want something that is fixed, that is in my mouth.
Okay.
That's the first kind of patient. Now,
so they actually go to you for dental implants because they're saying, I don't want my denture anymore.
Yeah. They come in and they say, there's something wrong, or they come in by accident and they say, I need a reline, and I say, no, you don't. You need an implant. Okay. And the second set of patients are people who have gone years and years with failing dental treatments. They've had a root canal that failed, crowned it, retreat. You got to take off the crown, redo the root canal, do the crown once again. They lose the tooth, end up getting a bridge, and so their dental appointments are extended. Every time they come in after a failed tooth, something else. It's kind of like they open Pandora's box, something wrong. And so these are patients that are just fed up with their teeth, with their own natural teeth. They say, I need something different. So that second group of patients, they are headed towards dentures, and that's why they come to us, because they don't want dentures. They're not at that point of their life where they ever thought they could see themselves in dentures. You don't want to be a 40-year-old woman thinking, I'm headed for dentures.
Do 40-year-olds have dentures?
Oh, absolutely.
Really?
Yeah.
Okay.
The youngest patient that I have, 36 years old, Randy, 36 years old, this patient, she has an upper complete set of dentures. She can't even take it off at night because she's so embarrassed to have her husband know that she's fully edentulous, hides it from her husband. Okay, that's one of the people whose lives we're trying to change. With this prosthesis that we're making, with this fixed set of teeth, she never has to take it off. She doesn't have to live through that embarrassment. And so these people that are headed to dentures, they can have something that stays in their mouth. They smile a regular day, new set of teeth.
Now you helped, I guess, one of your grandparents.
I did.
With their teeth. Tell me about that.
Yeah, so my grandpa, he is, and he's typical older Mexican man, he loves eating his chicharrones and his soup with the huesitos, and he sucks these bones, and he had been through partial denture after partial denture. He was missing his front 4 teeth, okay? So what we did for him was place implants and make a bridge, okay? He didn't need an entire new set of teeth. He just needed some front teeth so he could suck on those little bones. And so it doesn't only qualify for patients who need full set of teeth, also for patients who are looking to fix big spaces, big gaps. We can do that with implant supported teeth. So my grandpa, he was on that track for getting a complete denture on the upper. He had broken so many partials that we were looking to get him a full denture. And he is one reluctant man.
Can he eat? I mean, does he have to be careful, like what he's biting into with those front teeth?
Oh yeah, the little clasps, they dislodge so easily. He bites into something and it's wobbling, it's moving around in his mouth, and he can't enjoy the things he used to enjoy, And so
what about now?
Oh yeah, now he's sucking on those bones. He can
eat whatever he wants.
He can eat whatever he wants. He can
even
bite
like
into
a
things.
hard carrot, they could bite with their front teeth.
Bite with their front teeth, just get in there edge to edge.
So is this the newest trend in dentistry? Like dentures as we know them today, right? Do you think 20 years, 50 years, they'll be gone? Like they'll all be attached to something in the mouth?
Oh
like
yeah.
Implants?
Absolutely. People don't want to have these floating pieces of plastic in their mouth. And I think now with all of the developments in dental technology, people are starting to realize that these little plastic things rubbing around, mashing food together, isn't the way that it should be.
Okay.
People are realizing they want something anchored to their mouth. They want to wake up and have full set of teeth. And Randy, we're born with baby teeth. We lose those. Then we have adult teeth. And some of us don't take care of them, and we lose those too, And now with these dental implants, we're able to give them a third set of teeth.
Nice. Now it seemed painful. Is that something they complain about?
Randy, they're numb. Just like any other regular procedure, you come in for a filling, it's the same kind of anesthetic that we give you, so you don't feel anything, really, you know what I mean? During the actual procedure, you're numb, and so you hear the whirring, the zzz, zzz, and that's about it.
All right.
Yeah,
now
so
what
if you
about
can sit
afterwards?
through
What's it
that.
like afterwards?
they can go to work the next day. They can get up, go to work the next day. It is a very minimally invasive surgery.
Okay, now you have this team approach. So I guess how dental implants, and you have a large center you're working at, that I guess how it's normally done is you go to one doctor that does the surgery, and then you go to another doctor that puts the teeth on top, another place for the imaging. You do it all right there.
We do it all in one practice.
So aside from convenience, what's a big benefit?
Well, convenience is a big thing. You know, you're a working man. How many days of work do you want to take to get your teeth done?
Okay, good point.
Yeah, right? And so you want to have everything done in one center. Everything done by a group of doctors working together, getting it done in, let's say, one visit. One visit, sometimes two visits, depending on the case. But really, convenience is a huge thing.
So in-house, you have an oral surgeon that works with you. Is that right? So what's your role?
So I get the fun role. You know, I get the role of actually delivering the new set of teeth. I get to design them closely with the lab, and we choose teeth that work in your mouth, that make you look beautiful, make you look youthful. Whatever it is that you're looking for, we can provide that for you.
Now in Modesto, Central Valley, are there a lot of people wearing dentures? I mean, is it a big problem?
Oh my gosh, a problem? So according to the Journal of Prosthodontics, by the year of 2020, 38 million people, Randy, will be wearing complete dentures. Okay, so let me kind of quantify this. It's really a big number. Let me quantify this for us in the Central Valley, okay? So let's take the diehard fans of the Warriors, the Niners, the Oakland A's, and the Giants. Let's fill those stadiums, times that by 3, and that's how many people are wearing dentures in the Central Valley.
That's a lot of people.
A lot of people, a lot of people, and it's a problem.
So if there's so many people then in Modesto or the surrounding areas that have a denture, upper or lower, why aren't they all doing it? I mean, what's your take on it? Why aren't they all coming in and getting dental implants?
Right.
New
So
teeth.
this is my take on it, Randy. There's a few things that are a problem for these people with dentures. Number one, if you're a denture wearer, you're most likely out of the system. You're not coming in for regular checkups, regular cleanings.
Okay, good point.
You're
All
not
right.
seeing your dentist. You know, it's been 7 or 8 years since you've even been in. And so the fact that they don't know that this is an option for them, they're not.
So that's number one. Okay,
That's
so they don't
number
even
one.
know that this is out there.
Exactly. Number two, Randy, is these people who are denture wearers have had it pretty bad in their whole career as a dental patient. You know, we're talking 30 to 40 visits to the dentist. We're talking procedure after procedure, failed treatments, new treatments. I think dentists, we're probably the bad guys to them. You know, they don't want to come in and see us. They don't want to come in and see us.
So it's hard to get those people in.
Exactly.
The
It's hard to
denture
get
wearers.
those people in, and they feel, sometimes people can attribute the dentist to a painful experience, and so we may be the last people they want to see. And so they're taking themselves out of the running for this new set of teeth just because they're scared to come in. So back to your question, the third reason why I believe people aren't coming in to get these new fixed teeth is that they think they're too old. You know, we have these people that
How old can you be?
Oh, how old can you not be?
Okay.
Okay. I have a colleague working on a 97-year-old woman. A 97-year-old little lady, she lives at
Why
a
would
care
a
facility.
97-year-old want to do this?
Well, because they want to eat and chew. They want to
Okay.
want to have the ability, just like you and I, you know, if you're lucky to be 80 years old and retired, you have people visiting you, bringing you food, you're going out to eat with your friends, like that's your new lifestyle, you know? And for this last leg of your life, why would you not want to have something that you can actually chew and eat at family barbecues?
Okay.
These people, they want to hold that rib, take a bite, rip off the meat with their teeth, with their actual teeth, you know? And so it's something that everybody should be able to do, chew, eat, proper function of your mouth.
So if 97-year-olds are doing it, I guess 80 or 75 is young.
Oh yeah, 70, 85, you're baby boomers, you know?
So statistically, they're not more likely to fall out, these dental implants, when
No.
you're old?
No, absolutely
Okay.
not. No. The quality of bone is still good enough to hold a dental implant if given by a board certified oral surgeon, somebody who knows what they're doing, somebody who has carefully treatment planned this. You put those implants in there, those babies are not moving.
But isn't it true, if you've been wearing dentures like 10 years, 15, 20 years, you don't have enough bone to do this, to get a new set of teeth with dental implants?
Not necessarily, Randy. That's definitely not true. So there are new ways that we can add bone to these patients where implants are possible for people who've been wearing dentures for 20, 30 years. And
Is that right? Okay.
Yep, yeah. And so it really takes coming in, getting that scan, getting that 3D x-ray of your head, and luckily in our practice, we're all set up to do it. You know, you just got to come in. We have to, that patient needs to have the desire to come in and start the process.
But what about people with bad gums, like bleeding gums, bad breath? They have gum disease. Are the implants work for them?
Yeah, so this is the
Will they
ideal.
stay in even with bad gums?
This is the ideal patient, Randy. You know,
Okay.
this is the patient that has bacterial infection living inside the tooth, living in the gums. Okay, there's
Okay.
a little pocket between the gum and the tooth, and the bone in the tooth, and where that infection lies. If you clean that out, if you properly remove the infection, these gums will heal healthier than
Okay.
they were before. And you can place implants in the placement of these teeth that will hold up the bone level. And that's really important, Randy, because what people don't realize is that after they lose all of their teeth, you know, like the Snow White, like the little witch, the
Yes.
little witch face, yeah, where
Like
the
the
chin
nose?
touches the nose.
Okay, okay.
Absolutely. So when you lose the teeth that hold up the bone, that's when people start looking older. You know, patients come in, you could be 60 years old looking like you're 102 because your face has shriveled in so much. And so with these
Interesting.
implants, they hold up the bone level in a healthy way.
Now you say you give somebody their teeth back, it's life-changing.
Oh yeah,
Really?
yeah. Let me give you an example, Randy. Okay?
Okay.
I had this patient that came in, sweet 67-year-old lady. Okay, she had stopped going to brunch with her friends because they used to do this prefix menu thing, and there was always salads, and they were always kind of like, "Why aren't you eating the salad?" You know what I mean? I remember her telling me the story, and she's like, "I'm so embarrassed for the fact that I chew like a cow in front of my friends that I refuse to go." Okay, Randy, we gave her the new set fixed teeth. Imagine how happy she is. Her social life is back. She
Okay.
can meet up with her friends. She can do the things that she wants to do, laugh out loud. Some of these patients, their major complaint is when I open, it dislodges. Imagine you being on a date, you being out with a gorgeous woman that you're
Okay.
talking to, and all of a sudden you laugh at a joke a little too hard and your denture flops out on your pasta.
That's a good point. So there's people that are dating with dentures.
Absolutely. You know,
So it's like they have a secret or something.
oh yeah, these patients, you know, 60s, 70s, you see them on Match.com, right? They're dating,
Okay.
and if you have a denture, you kind of have a dirty little secret, you know? When is the point that you tell the person that you are talking to, hey, by the way, I don't have teeth?
Well, now, when it's all done, what do they like more? The appearance or the fact that they can eat and chew whatever they want?
It's different for every patient, you know, it's different for every patient. Some people come in because they say, I miss food, I miss biting into things. And some people say, I hate the way these big plastic things look, give me something that looks a little more natural. But in the end, they all kind of come in the middle and the meet in the middle. Somebody who didn't care so much about the aesthetics is like, you know, loving the way they look now. They just
Okay.
wanted it for function. And they come in and they're the most confident that they've ever been. You know, there are patients for 5-10 years and you see them and the confidence that they exude just from having their smile, it's huge.
So you say they act differently,
Oh yeah. People,
like almost unrecognizable.
yep,
Really?
unrecognizable. You know, sometimes we'll have patients that come in, and the girls in the front have actually told me a story. There used to be this guy that came in. He was grumpy, but not in a rude way, but just a little bit grumpy. You know,
Okay.
he would come in, check into his appointments, that's it. Say nothing else. We gave him his new set of teeth, Randy. He comes in, he's flirting with the girls in the front now. You know, he feels confident enough to leans up on the desk a little bit and has his little flirt on because he has these teeth that make him look good.
Now, we have to mention, though, that even the best dental insurance doesn't cover the whole thing. Medicare, Medicaid doesn't cover it at all.
Yeah, but you know, we're financing this. You know what I
Oh,
mean?
really? Okay.
Yeah, exactly. We have a team of people that will work with your insurance. You deny the claim, it's okay. We'll try again. You know
Okay.
what I mean? Like we're pushing to make this happen for our patients because we believe that much that they need this.
But people are financing. Like you have lenders, as long as you have okay credit,
Yeah,
you have
yeah.
lenders that'll finance the procedures.
Yeah, and we have separate care credit is what it's called. It's a credit card that a person can open to get dental treatment. You know, Randy, if this person is out there spending $50,000 on a new truck, but they have one tooth dangling in the front, like, you know, your priorities are a little bit off. You know what I mean? Or get your truck and then ride in the truck with your new set of teeth.
Now, who's more likely to do this, the men or the women? Because I know men are like wait until they're in so much pain. They
Yeah.
come in when they can't take it anymore? Or?
You know, Randy, it's the same across all boards. You know, if you look at Cosmopolitan magazine, if you look at Men's Health magazine, they have taken surveys and asked both sexes, what do you find most attractive in a person? And across all boards, It's the smile, Randy, and it's not because I'm a dentist, it's tried and true. Ask people on the street, what do you look at first? If someone is walking down the street smiling at you, my eyes are drawn to you. I'm looking at you, you have drawn my attention.
Now, it doesn't surprise me that you say that because you're a dentist, right? The smile is like the most important thing.
Absolutely, absolutely. But Randy, take Hollywood, for example, okay? So in the movies, when the director wants to make somebody look poor or unhealthy, what do? They give them bad teeth.
That's right. Okay.
Right? They give them bad teeth. The villains always have weird, kind of creepy teeth, and the hero has this great, big, beautiful smile with white teeth. Okay.
If you want to make somebody look dumb, you always see them like in Halloween.
Oh,
they black out the tooth.
They black out the tooth, or they give them buck teeth. The cartoons.
Yeah.
40s and 50s, they used to have cartoons with big buck teeth to make them look dumb. And obviously we don't do that anymore because it's offensive, and people now care about their smile more than the dentist does.
So people with bad teeth are judged. Is that what you think?
Randy, it's not necessarily that they're judged. It is that their confidence is not there. Okay. So, for example, you take two twin sisters. They go in for a job interview. Okay. Same exact look, same exact smile. One of them feels self-conscious about the gaps she has in between her teeth. She is not smiling, very serious during the conversation. The other one embraces the gap. She's laughing, she's smiling, she's engaging with her smile. Out of those two, 100 times out of 100, the one smiling will get the job.
That's a good point. Because you're going to hire the person that seems positive.
Absolutely.
And self-confident.
It is your confidence. And so, we're not selling smiles for the sake of you need better teeth. We're selling smiles for the sake of your confidence, your own self-worth.
Now, in your practice, you say that you offer options, many options. That some places you say only offer one thing, like only implants, extractions, implants. Yes. Elaborate on that. What do you mean?
So some places will want to remove all the teeth and give you a whole new set of teeth, but sometimes that's not necessary. Sometimes you just have a few teeth that are bad teeth. And what we can do is treatment plan, take out the teeth that are just the bad ones and replace those with a new set. You want something fixed. People don't want things that come in and out anymore, Randy. You know what I mean? It's 2019. You want something that stays in your mouth, that looks like your natural tooth, that fixes the gum, because even sometimes with these bridges, after your gums continue to recede, you get that little space in between the fake tooth. And so with the implant, you are eliminating all of that.
So would you say this is the new hottest trend in dentistry? Because and we talked on the phone about this. The dentistry has always been like temporary fixes, like patchwork in a way. I'm using the word patchwork. And now dental implants, it's like getting your teeth back.
Yeah, Randy, no more Band-Aids. No more Band-Aids, quit just patching it up. Do the right thing, fix your teeth the way that it should be. New teeth, like I said, a third set.
Are they getting like oral sedation, nitrous gas, or what are they getting? Like what do you recommend?
So it all depends on the patient. Some people, they just want to be numb. They don't care about being knocked out whatsoever. Other patients, they don't want to feel that anxiety. And so we give them nitrous, we give them sedation, they take beforehand pills. Like
an oral sedation.
Like an oral sedation, exactly. And so you're awake throughout the whole procedure. So in most cases, you don't need to be IV sedated. If you're a little bit anxious, we put nitrous on you, and that's enough.
Now for dental phobics, is it true that some people, you have to even give them a pill the night before the appointment because they're so stressed out about it?
Yeah, and we can do that. You can give people pills the night before. You give them it a couple of hours. It really just depends. Treatment plan with the patient. You can tell a person who is freaking out about something. You can tell a person who just wants a new set of smiles, is eager to do it. They're just like, do it right now with no dental anesthetic. And so it takes a careful team, and I think we have that, Randy.
Is this the happiest group of patients? I mean, more than veneers, more than everything else, that when you give people that didn't have teeth and now they have teeth, like they want to hug you almost. I think you told me.
Yeah, no, these are the patients that feel like they're getting their life back. These are the patients that have, had doors closed on them because of their low confidence or because of their bad breath, their flaring teeth. And it happens, These are the patients that when they get that new set of teeth, their life is transformed.
Really? Now on the consult, people tell you their hard luck story about how their, teeth went bad. Do you ever get excited thinking this is going to be good?
Oh my gosh, yeah. So I had one patient come in.
Okay.
Okay, she came in with just her anterior teeth. She had canine to canine, so these 6 front teeth. And
So she just had 6 teeth left.
she just had 6 teeth.
Okay.
And this is what she dealt with, She doesn't really chew. I asked her, how do you eat? She's like, I really don't. She mashes her food. She blends it. Everything she eats, smoothies.
Okay.
Okay. The periodontal disease was so bad that the teeth kind of look like, little wind chimes. They're moving. So she came in, her treatment she wanted was me to bond all 6 of them together because she thought by bonding them, they would stay in the mouth. And that's not the problem. The problem is the gum disease that she has.
Okay.
And so it took multiple appointments for me to prep her to losing her teeth, because some patients aren't ready, Randy. Some patients aren't ready, and you have to really work with them and work to make them understand that you're never going to be without teeth. This is going to be better, and this is why you need it. And the second that it clicks, the second that she realized that she was going to get a full new set, even teeth to bite with, because she can't eat. She's skinny little lady. And so the second that we gave her those new set of teeth, Randy, she looked at herself in tears.
Nice.
She couldn't speak. It's almost like she covered her mouth again because she wasn't sure what the teeth were. And just to see somebody who has struggled so much with their self-confidence, struggled so much with their health, have that moment of just peace, have that moment where you can tell that her life, this is the beginning of the rest of her life.
Now, is this one of those things where they say, I should have done this years ago? Like when it's all done, they're all healed up.
Oh yeah. I mean, she was reluctant to get it done. And then after she got it done, she was like, why did it take you so long to convince me? I was like, you know what I mean? I'm like, I didn't have to convince you. You had to convince yourself.
Like even your grandfather, you gave him new teeth, right? And you're giving it to him for free.
Oh yeah.
It's even hard for you to talk him into it, right? Because
Absolutely.
they're worried about surgery.
They're
Or they just
nervous
hear it,
about
they
the
don't like it.
surgery. They don't know what they're like, a screw in my bone. No, I don't want it. I don't want it. You know what I mean? Like people, they just hear things on the street. Other people think it's so expensive. They're like, I can't do it because it's the cost of it. But Randy, we're not replacing every single tooth with implants. We're putting minimal amount of implants that will hold in this full arch of teeth.
You say sometimes as little as 4 implants?
Little as 4
a whole
implants
set of teeth?
for your whole bite.
Is that right?
All of the teeth, Randy, with just 4.
When it's all done, if everything works out, how soon could they eat?
Oh, that same day. We have people, posting photos of them that night out at dinner, finally enjoying that pasta, that salad, whatever it is. Take it easy, don't go crazy. However,
okay.
yeah, exactly. But you can eat right away, and slowly as you start to feel your own body healing, your limits, and patients within a few days or that same day completely life
And they look
changed.
real.
And
you could make them look real?
Oh yeah, you make them look real. With the new technology we're using nowadays is zirconia crowns, and I mean, they look gorgeous. They're beautiful. They look like real teeth. You can even give them like that natural little contour, the shade difference, and so they look real teeth.
So we are short on time, probably a minute and a half left.
Okay.
If somebody's watching this, and they're the 2 groups, they have teeth, but their teeth are bad. They probably have to all be removed. And they don't want dentures. That's one group. And then the denture wearers. So when they go to your practice, what are their options when it comes to dental implants?
Okay, so for the denture wearers, we can do something where we have teeth that snap in, snap out, okay?
Okay.
2 sets of implants that go right in here, and they physically snap it in, snap it out at night to clean it, whatever. There's some movable parts to it, and that's the first kind. Teeth that snap in. However, they're fixed, and so miles better than those, floating dentures that people can't even bite into a sandwich. You bite into a sandwich and the denture comes out with you. No, with these snap-ins, you bite, your teeth stay put. The next level up, you can add maybe 4 implants on the bottom, a bar in there that makes it a little bit more stable. You can eat certain different things. It's just a little bit.
But they snap in, snap out.
They still snap in, snap out. Yeah, just a little bit stronger. And the next level up is getting a brand new set of teeth that don't come out. They are fixed inside of the mouth. They are your brand new teeth.
Okay, so it's a little bit more expensive.
A little bit.
But it's worth it, because that's what people want, right? Teeth that don't come out.
Exactly. You have people saying, I'm going to the dentist to get a cleaning when they haven't been back for 20 years. They're excited to go back in. They're back in the system. They have
So
a
when
set
they
of
have their
teeth.
new teeth, they're just like every 6 months get them
Just
cleaned.
like every 6 months, you come in and you see us, and it's like you have a new set of teeth. You treat them just like that. You brush them at night. You keep them clean, and they don't come out,
Randy.
Randy.
The upper, because of the suction of the denture, the uppers are fine. right?
Oh, well, Randy, you've clearly never worn a denture. You know, you tell that to any other patient and say, hey, your upper denture is good, right? Because of the suction. They hate it, Randy. They hate it because it covers all of the palate. For people who have the gag reflex, that upper denture is where you put all of the adhesive. You know, it's covering your palate. It's sticky. You can't taste food. Red wine, forget about it. You can't taste that because your mouth is covered.
Interesting.
And with these new fixed teeth, you remove that entire palatal piece. It is just on the arch, just like your regular teeth.
So they could taste hot things,
they taste
coffee,
spicy,
whatever.
Coffee. They can, taste as they please. You know, they can actually feel the roof of their mouth. For years, they haven't had this sensation. Is really what it is, of being able to touch your tongue to your palate and really enjoy food in your mouth.
Okay, so if they're in Modesto, let's say you said, okay, denture wearers, I know this is not possible. Come try out a brand new set of teeth that are fixed in your mouth for the weekend. Like on Monday, could anybody go back? Like everybody would say no.
Oh, nobody would bring them back. No.
Okay.
No, you would take them and run Hot Wheels,
Is that right?
Yeah. It's so life-changing, Randy, that people will never want to go back to dentures, ever.
We're completely out of time. We should mention, I guess you speak Spanish. Are there a lot of Spanish speakers where you are?
Modesto's a huge population, Hispanic community. And so that is my favorite part of coming into work, Randy, is the fact that I have these patients say, Doc, I've never been able to speak to a doctor in Spanish, in my native tongue.
Oh, that's nice.
Yeah, it's huge for them because it's not only makes them feel comfortable, but it's this relationship that they gain with their doctor, being able to actually say, this is what I want, this is what I need. What are my options?
Now you wanted to make sure, one of the things that you said, we're going to do this interview today, but you wanted to make sure, because everybody comes on my show and said they have a great team, but you said we really have a great setup here, like 40-something employees. I mean, it's a big place.
Oh yeah, it's a really big practice, Randy, and all of us are just the cohesiveness, one person checking on another person, our team of doctors. I mean, I don't want to brag, but I work with some really smart people. When I came into the practice, I came in and had a whole new set of mentors. Like, these are skilled doctors that I'm so comfortable saying that they are my mentors, and I enjoy working with them. Nice.
Okay, final message. Somebody watching this, they're either a denture wearer or they're headed to dentures. And they've heard what you had to say, but for whatever reason, they're still scared or skeptical. What do you say to them?
Randy, I just hope what I have said has been able to ignite a fire in them that they deserve to change their life. They want better for themselves. They want to be able to eat that delicious corn on the cob. They want to be able to be out with their friends and laugh. They want to go to their kids' baseball games without worrying about yelling and their denture falling out, I just hope that one of these viewers realizes that they need this for their own life.
So to come in, get a consultation, know your options.
Free consultation. Come in and see us.
All right. Thanks again for coming on the program.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you could help.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.